Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
The highlight of the day, the drum roll sort of highlight of the day, is something we all need to be pretty concerned about, which is our heart health, okay? This is, do you understand if your heart stops, you're going to die? Right, do you understand that? Actually, technically, that's not your heart stopping that kills you, because of course the machine could keep it going. It's the circulation, that the blood, the oxygen's not getting to your cells, and then that's what kills you, all right? It's all about circulation. And so this is a talk about what powers that circulation, which is our heart. And this is Dr. Benjapa from Bangkok Pattaya Hospital. And that's when Thais are born, you might know they get a fairly formal name. Often it's a Sanskrit name, and then they get a nickname. So sometimes it's a nickname like Nu, which means mouse, or so her nickname is, I love this nickname, Benji. All right. And I actually told her, oh, Benji, it's a very famous dog, and here's pictures of this really cute dog. It's cute like you, right? Blah, blah, blah. She'd never heard of that before, right? Never. So, okay, so I know whatever else you might not take in today, you're all going to go away with, oh, that was Dr. Benji, okay? You're not going to forget that. So, and I'm sure we'll not forget this talk. Please come up, Dr. Benji, Dr. Benjapa, and...
So I want to begin with a short video, okay?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So, สวัสดีค่ะ Good morning, everyone. I'm Dr. Benjapa, or you guys can call me Benji, cardiologist at Bangkok Hospital, Pattaya. It is truly an honor, and I'm very excited to be here today. Thank you very much for joining me. I know all of you come from different countries, different walks of life, but I believe that every one of you, including me, we share a similar dream. When we retire, we want to travel. We want to spend time with our family, swim, play golf, walk by the beach, or spoil our grandchildren a little. In other words, we want to enjoy the freedom we've been worked so hard for. But there's one thing that can quietly stealing that freedom away. And today we are going to talk about them, the silent killers. Non-communicable disease, or NCDs, account for 75% of the global deaths each year, meaning that in every single minute we are all sitting here together, 80 people die from this disease. But the good news is it's not inevitable, but it's avoidable. What are NCDs? NCDs are non-communicable diseases. They are chronic, non-infectious illness, not passing from people to people, but progress slowly over years. Rarely completely curable, but absolutely preventable. NCD includes a variety of diseases, such as cardiovascular disease, for example, heart attack or stroke, chronic respiratory disease like asthma, diabetes, cancer, and neurological condition. They don't put on disguises. They don't lurk in shadows. Instead, they live among us silently, stealing time, health, and millions of lives each year. They are called silent killers, powered by equally silent forces: what we eat, how we live, and the choices we make. You may all feel fine until you don't. Of all the NCDs, cardiovascular disease account for the leading cause of death, nearly half of them. But they are preventable. And the journey starts with a few steps after we understand all the risk factors. And few simple steps we will be exploring today. American Heart Association called this life essential 8, but I actually think of them as an investment. Imagine you guys have 8 different bank accounts. You deposit a little on each account every day. Your wealth will grow. Health is similar. It isn't built by one day, but it's gradually building in thousands of days. So from the next 30 minutes, I hope that each of you find one habit, starting with only one habit, that you'll commit to changing after you walked out of this room today. First essential, of course, avoid stress and get healthy sleep. Most adults need 7 to 9 hours of sleep every day because it promotes healing, improves brain function, and reduces the risk of every chronic diseases. And stress isn't only your mind. It's actually affecting your heart and your brain. Higher stress in the preceding year is leading to first myocardial infarction. Stress triggers cardiovascular disease by inflammation, autonomic dysfunction, and also engagement in unhealthy behaviors. Second, and the most biggest part, eat better. It's about the overall pattern of eating, not just one single supernutrient or superfood. Starting early and consistent will definitely improve your health. And it's about making better choices most of the time. Notice I didn't say all the time, because eating should still be enjoyable, right? So, American Heart Association have just launched 2026 dietary guideline, but I will summarize into 4 do's and 4 don't. The first do, of course, plenty of vegetable and fruits in part of every meal. Everyone knows the benefit of vegetable. And if you can choose, try choosing variety of vegetable. And for fruits, try choosing whole fruits instead of juice. And this is the example of healthy plate. 1/2 should be vegetable with a small portion of fruits, and 1/2 should be carbohydrate, and 1/4 should be carbohydrate, and 1/4 is protein. And for protein, it is recommended to switch occasionally from meat-based protein to plant-based proteins, as shown in the picture, and regularly consume fish and seafood as part of your protein. Try choosing low-fat or fat-free dairy product. And if red meat is desired, choose lean and limited portion. And every adult needs about 0.8 to 1.2 gram per kilogram of protein every day. And these are the 4 nuts you should go nuts for, which give you protein, fiber, vitamin, antioxidant: pecans, walnut, almonds, and macadamia. And these are the 4 misunderstandings of protein. People often ignore plant protein, which is a good source of protein. Also, they are being scared of eggs, but actually the Heart Association recommend up to 2 eggs per day for a good source of protein. Getting stuck in a rut, people often eat the same kind of protein every day, but I would recommend to switch into variety of protein. Also, don't rely on protein bar because they contain high sugar, they are processed, high additive. The third do's, whole grains. Just a simple step from shifting refined grains to whole grain. For example, white rice to brown rice, cereal to oatmeal. That will definitely decrease the risk of cardiovascular disease. They contain more fiber, more vitamins, and more minerals. The last deuce, unsaturated fat. Replace saturated fat with unsaturated fat, including polyunsaturated and monounsaturated. For example, switch from butter or palm or coconut oil to non-tropical plant oil like olive oil, canola oil, soybean oil. This will lower your bad cholesterol. And this is the component of fat in each type of oil. As you can see, the butter and coconut oil contain high percentage of saturated fat, while canola oil or soybean oil contain more mono and polyunsaturated fat, which are healthier. Okay, moving on to the don't. The first don't, of course, added sugar. Limit food and drinks with added sugar. Added sugar can be in form of syrup, honey, or fruit juice concentrate. Every day we should limit the adding sugar to less than 10% of the daily calories intake. And if you can choose water and unsweetened beverage instead of sugary drinks. The second don't, minimize the sodium. Sodium are not only contained in salty diet. Top high sodium foods involve processed food, canned, pickled food, cheese, which are all delicious, right? Try reducing them. And some people, they may mention potassium enriched salt as a option, but you should consult your personal health profession before you switch them. The third don't, ultra-processed food. Food processing is not always bad. They sometimes increase the shelf life, reduce the cost, and preserve the essential nutrients. But processed food should be limited to minimally processed or unprocessed, because ultra-processed food involve extensive industrial processing and also a lot of unhealthy ingredients such as sodium, sugar, fat, and additive. The ultra-processed food includes like ready-to-eat meal, soft drinks, or nuggets, hamburgers, which they causes overweight, obesity, heart disease, diabetes, and early death from any causes. Last but not least, the fourth don'ts. Before I begin, may I please have, can you please raise your hand? If any of you have regular alcohol intake, can you please raise your hand? Okay. So I'm assuming that the rest of you doesn't regularly consume alcohol, okay? The medical advice is straightforward. If you do drink alcohol, limit. Oh, never, really? Okay. Maybe tonight, no. If you don't drink alcohol, don't start. But if you do drink, limit them. Currently, there's no confirmed heart protective evidence from alcohol. And alcohol can increase your blood pressure, cause heart disease, stroke, and throat cancers. And by limit, I mean from male below 2 standard drinks per day, and for female below 1 standard drinks per day. A standard drink can be simply calculated by formula, or it's equivalent to like 1 glasses of beer or half glasses of wine per day, okay? The third essential, be more active, because every step counts. By being more active, it can include just 1 step of walking every day, increasing them, or the recommendation for aerobic exercise would be 150 minutes per week of moderate aerobic exercise, like walking, dancing, or even gardening is considered moderate aerobic exercise, or 75 minutes of vigorous aerobic exercise, right? Running, swimming. They can mix, and you can spread them throughout the week, which would be like 20 to 30 minutes per day of exercise. And once you do the aerobic exercise, I would also recommend muscle strengthening exercise, which helps preserve your joints and increase your muscle mass. Also, you can increase the intensity of the exercise. If your daily activity involves a lot of sitting, try go walking or stretching just once in a while every day is better. The fourth essentials, halfway down, diabetes is one of the most threatening disease. Sugar slowly but permanently damage your brain, your kidney, your heart, and can cause blindness. Most of the time, high sugar level doesn't have any symptoms, but if they do, they will cause like tiredness, unexplained weight loss, always thirsty or always hungry, or some people may have numbness in their arm or foot. Then if this occurred, you should seek for medical advice. And the number that is important to keep in your mind is monitoring fasting blood sugar or hemoglobin A1C. The difference between them is that the fasting blood sugar reflects the fasting of the night before, but the hemoglobin A1C on the second column reflects how well you control your blood sugar in the past 3 to 5 months. So if you have been consuming like Coca-Cola for a month and then you stop for a night, the hemoglobin A1C will definitely show that. Okay, and the number of the fasting blood sugar should be optimal below 100 and hemoglobin A1C below 5.7. Halfway down, 4 more to go. Managing weight. Maintain a healthy weight is recommended. You can simply use the tool of body mass index or BMI. We can calculate them by dividing the weight in kilograms in the square of your height in meters, and the optimal number should be between 18.5 to 24.9. Okay, the 6 essentials control cholesterol. We as health profession consider LDL as the main bad cholesterol we are preferring to control because it directly affects atherosclerotic process. However, there's no optimal number for every people. It needs to be individualized according to each person risk factor, which it's my job after discussing with you. The 7th one, essential, manage blood pressure. The optimal blood pressure at resting should be below 120/80 because persistent high blood pressure causes stroke, blindness, kidney dysfunction, peripheral artery disease, and coronary heart disease. Last but not least, if you don't mind, can I please have hands of people who smoke regularly? None of you. However, how about people who used to smoke? It's good to hear that you used to, yeah, okay. So smoking is the leading cause of preventable death. It causes heart disease, stroke, cancer, diabetes, and dementia. So,
sorry, I have a question. What is the number you just
okay, so I think quit smoking, but I think nobody raised their hand, so I think nobody needs quit smoking. But if you do or your relatives do, then the success come with intention and also plan, okay? And these are the life essentials. It may seem overwhelming, but trust me, it's not. You can start simply by walking 10 more minutes a day, choosing the stairs instead, sleeping, going to bed 30 minutes earlier, or choosing one portion of vegetable more in every meal. Health isn't created in one day. It is built by thousands of small decisions. And remember, your health is your greatest wealth. The best investment you can ever make is your own health. Thank you. Are there any questions?
There is, for sure.
Yeah, hi, Doc. Hey, I went to Bangkok, and a big doctor up there, and little Thai guy, a really nice guy, and I'm standing up like I am now, and I said, "Hey doc," I said, "I got problem with my heart." And he walked up to me, he said, "What happened, Big Raw? What happened?" I said, "Thai lady break my heart." He said, cannot fix. He said, cannot. He said, "Me too."
Has anybody still got that ever had that heart problem in Thailand? Anybody besides me and Big Ron? I think most people here.
Can I ask
Yes.
my question? Hello everybody, my name is Larissa, short name is Lara, and I would like to ask, I developed recently, for recent years, I developed a high pressure. My pressure usually 150. But I feel good, I don't feel this pressure. Should I do something about that or not?
Thank you very much for your questions. Rola, right? Okay, is asking, she have been experiencing high blood pressure, but she isn't feeling anything at all. Does she need to be concerned? So the answer is yes, because high blood pressure will slowly, quietly damage the blood vessels in all parts of your body. And you said that you feel fine, because once you feel unwell, the symptoms will be stroke, blindness, cardiovascular disease, heart attack. So I would recommend to control that level within the optimal range before any of the things happen, before you feeling unwell. Okay.
Do you recommend prophylactic baby aspirin and prophylactic statins in the absence of any high risk factors and in the present with the normal cholesterol level, to just take them anyway?
Okay. So the questions involve two medication with statin and the aspirin. Beginning with statin first, you said normal cholesterol. I need to individualize, meaning that I need to explore every person, their individual risk. Some people said they have no cardiovascular risk, but for example, I'm asking their family members, their father have stroke, their brother have stroke, then this is one of the risks, meaning that there is no one number that fits all. So I need to individualize that the normal level of LDL, that should be the target of that person. If it's definitely normal, then statin is not needed. For example, if it's already below 70, that's right. And for aspirin for primary prevention, meaning that before you have any heart disease or stroke, is not necessary for everyone, because aspirin side effect is bleeding. Yes. So normally we see we have the indication for the baby aspirin. For example, we do people with high cholesterol. We may do the coronary calcium score, which reflects the calcium that attached to your heart vessels. And if that number rises, then to one point, it's definitely necessary for aspirin. But I would not recommend to prophylaxis taking aspirin. Yes.
So it wants to be taken under medical supervision, basically. You don't just
that's right.
take it into your mind that, oh, I'll go on aspirin and I won't get a heart attack.
Yeah, that's right.
Regarding the use of statins, do you acknowledge the effect of statins as a risk on tendons and spontaneous rupture and easy rupturing of tendons even after an insignificant fall?
Okay.
Some people don't think about it as a risk, as a worthwhile risk.
Okay. I want to show you this image. Do you know what is this one? This is peanut. That's statin. People would often say, no, I don't want statin because it's causing side effect. It can causing rupture tendon. It can causing my muscle to be destroyed. But actually, the risk of getting dangerous side effect from statin is 0.001% per year. While taking peanut, which some people take every day, the risk of life-threatening anaphylaxis is 1 to 2% per year. So for me, if there is indication of statin, the benefit would definitely outweigh the risk. Okay.
Thank you, Doctor. It was a very helpful, informative speech. About 8 years ago, I went for a checkup and the doctor said my blood pressure was a bit high. I think it was around 140, 150 over 80 odd. So I went on low-dose medication. Then about 6 months ago, someone told me that beetroot was very helpful to beetroot. I did a bit of research on it and I found that I'd probably need to eat about 20 a day to lower my blood pressure. So I bought some beetroot powder, and a teaspoon of beetroot powder is like equal to multiple beetroot in a go. I also continued my research to find out that beetroot is high in oxalates, which can contribute to kidney stones. So I bought some calcium citrate, which causes the oxalates to just pass through the urinary tract, and you can safely take the beetroot powder. That was about 6 months ago, and I did my blood pressure test today, which I do just about every day. It was 120 on 80, and that's from beetroot powder and calcium citrate. Just food for thought, and you're the doctor. But you're probably not trained to tell people to take beetroot powder.
Also, I've heard that cashews can be quite good for lowering your blood pressure. I know somebody who systematically ate cashews and they lowered their blood pressure with that. So there are foods to consider. All right, another question, statement, controversy. Anybody having heart palpitations right now? Who's not in a relationship with a Thai woman, I mean, you know.
Thank you. I wanted to ask you about taking medications long term. I've been taking metformin for 25 years. I've been taking benazepril for almost 20, carvedilol as well. Rosuvastatin for at least 20 years. Are there concerns about being on these medications very long term?
I would say the medication you mentioned, metformin for diabetes, right? Statin for cholesterol, and also the blood pressure medication, and also the beta blocker. All of them actually, in long term, doesn't affect your kidney function, except that if there is some other precipitating cause. For example, if you happen to take any painkillers, anti-inflammation, taking any supplements, or you are in the illness in which you have volume loss of diarrhea, these external causes can precipitate abnormal kidney function while you're on the medication. So I would recommend before doing other external things, you consult with a health profession. But the medication itself not only does not affect the kidney, it in long term control of your underlying disease, which in long term definitely protects your kidney function.
Just a quick follow-up. I've started to develop peripheral neuropathy. I've seen information that I don't know if it's valid or not, that metformin interferes with the absorption of B12, and I've heard something about B12 in a liquid form being easier to absorb. Do you have any information on that or any insight?
So I assume that you have researched that B12 is related to numbness, right? Okay. So the actual relation of B12 to numbness is only if that numbness is from the lack of B12. So first of all, we can check that B12 level in the blood, and to make sure that if it's related to the B12 deficiency, you can get supplement of B12. But there are plenty causes of numbness. For example, from the vessel itself, without involving in any B12 deficiency. So I think we need to work up on the causes first. And metformin, in long term, it doesn't obviously cause a B12 deficiency in every patient. Okay.
Thank you, Doctor, for coming along. Yeah, I have atrial fibrillation, so I am actually, it's working, yes, it's working. So I am under the direction of your hospital, of course. And I'm on Xarelto at the moment, but I do have other doctors here that have recommended that you can have a catheter, or you can have something put up and have an operation to cure this. And the other thing is one of our Dr. Martin, who an expat doctor, suggests another drug that so I don't have to take Xarelto. So certainly this gentleman over here, he doesn't mind me talking about him. He's a medical, well, the two medical doctors there, too, and by having the things put up into your heart. So what's your opinion? I mean, when I go to the hospital, I'm on the right drugs and I'm going in the right direction. Is this the best thing to do?
May I ask you, besides from atrial fibrillation, do you have any underlying diseases? For example, high blood pressure, high cholesterol?
Yeah, I'm on blood pressure tablets, and I have sleep apnea, but I don't use it, the machine.
And also, how old are you?
It's 80 years old, yeah.
Okay, but
Give me a clap.
You look like 60, 70. Okay, so actually the thing I'm asking is that these are the risk factors, meaning that people with atrial fibrillations, especially if they have other comorbidities, high blood pressure, or their age above 65, this increases the risk of stroke. So with the two risk factors, your risk of getting stroke is about 3 to 5% every year. Okay, so the question is, you're asking whether is there any medical procedure that can be done so that you can stop taking Xarelto, right? Okay, there is medical procedure, for example, atrial fibrillation, AF ablation, meaning that it's a less invasive procedure, but we involve the wire inside your body and use electrical device to terminate the source of the AFib. After the termination, we monitor for the recurrence of the disease. It's about 1/3 of people, they have recurrence after the ablation. But normally, even after the successful ablation, I would recommend to take at least a year of anticoagulant. And then once a year, we can do the Holter monitor, meaning that the whole monitoring of the heart rhythm to make sure that the AFib is completely gone. And then the decision of stopping the medication can be discussed afterward. But there's option.
Thank you. But Xarelto seem to be the drugs that are the best drugs at the moment. Are they good drugs? Xarelto.
Yes.
Xarelto.
There are the currently best anticoagulant to prevent stroke in AFib.
Yeah, to prevent stroke. Thank you very much.
No, I just wanted to, I've got several heart problems. Dr. Pia is my cardiologist. He prescribes all my medication, which I'm quite confident in his ability and his professional opinion. But as to atrial fibrillation, yes, I have that. And he has me on Lixiana, the anticoagulant. I did have a stroke, but that was about 6 years ago. So I have that. Also, I have 2 blocked heart arteries. My heart built veins over, so needless to say, I'm also taking blood thinners. But so he's very happy so far with the medication is controlling my cholesterol level and all the other. My blood pressure tends to be around less than 140 over 90, which I understand for my age and condition is not good, but it's not that bad. But overall, the main thing is I was diagnosed with congestive heart failure. And as I understand, that can be reversed, but it can be slowed. And I do attribute to my doctors here because that diagnosis was given to me over 10 years ago, and I'm still here. But I expect that one night I'm going to go to bed and not wake up. And if that's the way to go, that's the way I want to go.
Thank you for sharing that.
Well, we're really glad you're still with us, Daryl, that's for sure. This is Tanya, who arranges so many speakers for the club, etc.
Okay, thank you very much, Doctor, for being here and coming to share the updated health information that's very interesting. As my age, about 43 to 45 years old, I do have annual checkup every year, including EKG. I do not have high blood pressure. I do not have any underlying diseases. But the problem is the EKG results show the sinus rhythm, and they show abnormal. After I seen the doctor, she said that nothing to worry about because of my age. But she said I maybe need to monitor myself about heart after 45 years old. I sometimes have low blood pressure, which is the opposite to the high blood pressure. My question is, what is your recommendation for me to look after myself, or what do I need to take, like supplement, or what I need to do to monitor myself? Something like that. Thank you.
Thank you for your questions. So first of all, the electrogram, the ECG she mentioned, it show abnormal result, but actually I need to see what abnormal result is presenting there. There are like plenty of benign abnormal result that can occur. For example, there may be slow heart rate, which can be found in normal people. It will report it as abnormal result too. Okay, so I need to, or you may need to confirm what kind of this abnormality is. And or some people, they have something called bundle branch block, or the abnormality of the electrogram of the heart, which some people develop. It come from birth and can cause no problem for their entire life, but it needs to be monitoring. So the question is, how can we monitor for any abnormality that can be from the abnormal ECG, right? I would recommend maybe smartwatch, so you can monitor for any, the best is irregular rhythm. Normal heart should beat regularly. Doop, doop, doop. Once they beat irregularly, even doop, 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 or any feeling abnormality, you should see your cardiologist to evaluate what kind of arrhythmia that is. Okay, and also with the blood pressure, my blood pressure is 90/60. So different people have different normal number of blood pressure. As long as it doesn't cause any symptoms or any abnormality, I can still run, I can still do everything, then nothing to concerned for the low normal blood pressure.
Yeah, thank you. Now I'm an old man, and I think many of them here in the room are old men. But when I was a young man, and maybe somebody else can remember, the blood pressure now is 80 to 120. This is what I have. Okay, thank you, God. But when I was young, the numbers were much more higher. Why? Because they want to sell medicine. This is what I think. Thank you.
I think it's based on statistics, to tell you the truth.
Yeah. So actually, blood pressure is things that vary for different people. Some people, as they grow older, their blood pressure become normalized by itself. Maybe because you have changed your lifestyle once you're diagnosed with high blood pressure. Some people, they can reduce the medication and then keep on monitoring the blood pressure. Some of my patients, after lifestyle modification, they can completely stop blood pressure medication. But for some people, as they grew older, their blood pressure grew with them. And some people, the medication that can once control the blood pressure, at one point, it may be uncontrolled. So the importance is that we do regular monitoring. And I will tell every of my patients, more important than the hospital blood pressure is your regular home monitoring of the blood pressure. Because many of people who come to the hospital, their blood pressure rise. So the home blood pressure is what I will believe in more than the hospital blood pressure. Okay.
Yeah. As people here might know, that's called the white coat syndrome. Yeah, they experience the stress of being in hospital and getting it done by a doctor. Now, Oh, just I noticed that you very wisely recommended people switch from white rice to brown rice or black rice. I wondered if you'd say a few words about the dangers of white rice, because it's plague proportions in Thailand. It's just one of the reasons diabetes is so terrible here.
The bad thing about white rice, right? White rice, when compared with unbleached, unrefined brown rice, white rice, it involved in the spike of blood sugar more stronger and more faster. That's in long term may cause insulin resistance, is the risk of getting diabetes in the future, which is the beginning of many diseases. And also the unrefined brown rice, they have more nutrients, more vitamins, and more fiber. So if you can choose whether white or brown, I would recommend brown rice, definitely.
Yeah, you really need to watch your white rice consumption. It's arguably worse for you than sugar, because the white rice also causes constipation, etc.
Yes.
So, yeah. Well, somebody whispered to me, she's one of the best speakers we've ever had. So a round of applause for one of the best speakers we've ever had. It was really comprehensive and sensible advice, and a small token of our deep appreciation. Thank you, Dr. Benji. Wonderful talk. Wonderful talk and wonderful PowerPoint as well. Really, really special. Please take that seat there.
Okay.
The good thing is, this is a very big attendance. We've got about 100 people here, so everybody knows. Firstly, they know that this is a very important subject. And secondly, they know wherever Bangkok Pattaya Hospital comes, it's going to be a great talk and great PowerPoint and great tests and a chance to win something. We're going to have a draw. We're going to have a lucky draw. Maybe the doctor can draw some out.
Okay, you can show first.
What's the big prize?
Car?
A car? Why not something even more exciting like a motorbike?
Thank you very much for giving us the opportunity to share the health information today. And yes, as usual, we provide you the special gift. It is a CT calcium scoring. It is CT scan that measure the calcium in your coronary artery. Yes, the voucher value 7,000 and it is transferable. So if you not wish to use it yourself, you are welcome to give
Sell
to
it
your
and
friend
make
or
money.
your family. Okay, the first lucky winner is number one.
Oh,
Wow.
first person here. Who was that?
Congratulations. Number one, please.
Oh,
Okay,
number one, Jan.
Congratulations.
Very good. Yeah? This is Jan Berry. Oh, yeah, photo time. Oh, really? You think so? Sort of an extra wheel, really.
1, 2, 3. Okay.
Thank you.
Thank you very much.
Thank you.
Inside I have the letter, so you can call or email me to make appointment.
The second lucky winner is the same.
Okay. 27.
Number 27. Check your numbers. Check your numbers.
Are you here? Oh,
Hey,
congratulations.
great. Yay, excellent.
Here you go.
Okay.
This is for history.
Okay.
Robin?
Similar. The same. No
contrast. 1, 2, 3.
Thank you. Congratulations.
Well, congratulations to our winners, and thanks again. And a special round of applause. Wait a second. Tanya, come up here. Come on, just quickly. Come up here. Come on. I want to get the team together. Come on. Tanya, for how many years? 15 years or something you were booking speakers in from BPH, and now Jesus taken over. So a round of applause to these two amazing ladies who booked the speakers and things for us. Thank you, Kunjis and Kuntanya.